So the issue that we're trying to address is that personal support workers, especially those who work in the community, get hurt a lot. And they get hurt because the work that they do is heavy physical work a lot of the time. The environments aren't set up for caregiving. They're people's homes, and sometimes they don't have the resources that they really need to provide care safely. The idea with this study is that we put some movement sensors on the personal support worker's body, and we just track how the worker's body is moving as they provide care to clients. And from that we can tell a lot about how hard they're working and what risks there might be to their safety. So the sensors are just capturing movement information. So by getting the velocity and the acceleration from the sensor, which is attached to the PSW's limbs, their arms, their upper back, lower back, thighs, and lower legs, we can build a model of how their body is moving.
I'm a PSW advisor for Emily. She will test on me using the sensor, different part of my body, and I have to say, is it comfortable for me or not? And also, when I'm used on my body, when I'm doing my personal care, is it not interfering with the service with the client?
The way that we use the information is that if we can estimate the postures of the personal support worker, then we can work out whether they are in postures that have been linked to musculoskeletal injuries. So back pain, for example, is incredibly common amongst personal support workers, amongst healthcare professionals in general. And one of the stronger predictors of whether or not somebody will experience work-related back pain is how much time do they spend bending over a lot. So if they spend a lot of time in a highly flexed position, especially if they're lifting loads at the same time, then there's a real risk that that will build to, not necessarily an immediate injury. It's a bit easier to work out how those sudden injuries happen. But there are cumulative injuries that happen where tiny bits of damage, not really noticeable externally, accumulate over time and lead to this sort of chronic pain. PSWs do not need any training to participate in this study. This study's been designed really with the idea of protecting client privacy. The researchers do not know who the clients are. I would meet the PSW somewhere nearby the client's house. And we would fill out a couple of surveys about how they're feeling that day and a bit of their personal background. And then I would help to attach the sensors to them. And once we've strapped the sensors on, we'll get help doing a couple of activities to let the sensors know which way is down and how they're aligned on the participant's body. And then they can just go and provide care as usual. And then they would come back and meet me again, and we'd download the data and run it through our processing program and get a little stick figure showing the PSW how their body was moving at each point during the visit. And then they could help to say, oh yes, that's when I was helping them to get out of bed. That's when we were doing the dressing.
It's really comfortable, and it's also fit in perfectly with my body. And when I'm doing the care, it's not interfering it.
We're validating the system now, and things are looking good, which leads us to the next exciting phase where we are about to actually take this into homes. So we are about to start working with personal support workers to identify visits where they can wear these sensors, and we can start getting that data from behind closed doors. We would be answering questions like, are there differences between when care is provided in the morning and when care is provided in the evening to the same client in the same space? How much variation is there in the risk factors that we record when providing care to the same client but over different days? Or to the same client but by different PSWs? Is there a lot of variation in the risk exposures based on just who's doing it? And can we identify maybe differences in their approach or differences in their technique that make the risk level different? And from that we may be able to work out better ways of training people so that they can provide excellent care but also do it in a way that's safe for them.
I'll tell the PSW it's a really exciting project. It's our own health, how we can be safe in the community. So join, so in future we'll be protected.